It's important as a person coming out into endovascular practice to know that you have to roll with the punches, that you have to be dynamic. Every leg is a little bit different. Every patient is a little bit different. The indications may change from case to case. So it's important to know what's in your armamentarium and be aware of the things that are out there for you to incorporate into your practice.
I went to a Medtronic sponsored course where you have hands-on sessions with the Hawk. You can talk to other users, you can review the data yourself and see how it stacks up against other atherectomy devices. But what's most important, it just really gives you the opportunity to really ask questions in an environment that you don't feel like you're being judged, and you can actually pick up the devices and play with it and take your time with it.
It was a pretty quick learning curve. I really liked the directional component of it and just the usability of the actual device itself.
I think in general, it takes about 2 to 3 cases to truly feel comfortable with Hawk. I think to really get a solidified knowledge of how to set up the device and how to really use its mechanism to optimize directional atherectomy.
I can tell you personally from my experience, it's a very easy to learn device. The learning curve is not very steep. You learn very fast. And as I said, it's very under the precisionist control, how much it's going to cut and directions it's going to be cutting into.
This really didn't demand that much more from me or my technical skill set, but it also allowed me, again, to rotate the head and really target my direction of atherectomy and debulk some of the plaque, as well as prep the vessel for possible future intervention.
As you become more comfortable, you start to use it in all kinds of morphologies. That includes soft plaque, heavily calcified, completely calcified lesions. And now it's my go-to for any type of lesion, really. It's my first device that I use. I mean, just like most things, the more you do it, we're all endovascular specialists, so we know what's safe, what's not safe to do. And as long as you work within the confines of what's safe, and you will get the results, at least I did. I got the results that I was happy with, and that's what kind of made me more and more confident. Having an algorithm is extremely important. Doing the same thing over and over and over is extremely important, and that's what made me comfortable.
Give atherectomy a fair shot. The data's out there, the literature's out there to support it, no matter what atherectomy device you use. With that said, if you like the control of being able to truly go after an exophytic lesion that's on maybe a lateral wall of a vessel or something on a posterior wall or anterior, it gives you the feasibility and the control to go after that lesion that you're there for. You don't have to just kind of attack the whole vessel. The learning curve, again, it's not going to ask you to utilize skills or techniques that you don't already have.